Again, good morning. It is April 5, MED120 Medical Terminology. I'm your host, Dr. Garais. And this week is week 4, digestive system. Next week will be your midterm exam. Your midterm exam instructions will be located in announcements. It will be online. The exam will start at 9 a.m. promptly on Monday, April 12th. And you'll go into your announcements, and there'll be a file and there'll be instructions on how to email me your answers. The answers for your midterm are due by around 10:15 a.m., give or take a minute or two. Um, and it'll be straightforward, 50 items, multiple choice on everything from module 4, which is digestive system, from the very beginning. So chapter 1, chapter 2, the chapter on respiratory, the chapter on cardiovascular, and the digestive system will be part of the scope for your midterm exam. And you'll be on your honor system, closed book. That's why you have an hour and 50 minutes to answer 50 items. But, again, you're on your own honor system. You can open up a book if you want, but ultimately you should be able to read and know these medical terms, for real life. And the two major questions that'll be on for this midterm is, do you know the parts? And do you know the meaning of the parts? And that's the worst I could do to you. So what's due today? All module 3 items, which is your medical language laboratory, which has already been graded, and your discussion, and of course, the quiz. And the quiz, if you did poorly, you can take as many times as you want. So keep on taking it until you get 100, and utilize this quiz more like training. There's no discussion forum for this week. Let's put that down because you should be studying for your midterm. For your midterm. So I'll give you guys a little break. Okay. So let's get back to it. What's the topic for discussion for today is the lovely world of GI, which is gastrointestinal, or GE, which is gastroenterology. And both mean the same thing. Gastro. Now, here's another case where there's two roots. You have gastro and entero. So gastro means stomach, entero means intestines. So the internal medicine specialist or subspecialist in GE medicine would be the gastroenterologist, and they're experts at, and it looks like a beautiful both A and B question, the stomach and the intestines. So that's one question I could ask. The other question is, what's logi? Is it a suffix? Is it a prefix? Is it a root? Is it a combining form? Is it a combining vowel? And that's the worst I could do to you. What's gastro? Well, that's a root. What's entero? Well, that's a root. So all intents and purposes, you're only looking at two archetypes or two types of questions for the midterm. And again, multiple choice, okay, and 50 items. So GI, gastrointestinal system, right? Gastro, stomach, intestine, al pertaining to. So whoever GI med or GE med, whatever they want to call themselves, they are a subspecialty of the Department of Internal Medicine. And they're the super, super experts at this picture. You have the upper GI, which is everything from the stomach on up. So it's everything here in the oral cavity. Then you have your esophagus, which is your food tube. And then here at the beginning of the stomach. You also have lower GI, which is your large intestine here, small intestines here, right? First it goes through small intestines and then it goes through large intestines from the stomach. And then you have accessory organs such as your liver and your gallbladder here. Okay, so upper GI, think what? It's all up here from the stomach on up. Lower GI, all down here from the this part of the stomach on down. So let's look at this. Let's look at some upper GI stuff, which is here. And this is the oral cavity. Dentist, dentology, logi, study of, or dentistry. Dentition is deals with your teeth. So dent is the root, ist is the suffix. Suffix means it's a specialist. But if you look here, don't get trapped. If I ask for a combining form, it has to be the root, slash, and an O. Okay? So don't just answer dent. Combining form is always the combining, because combining form is always the root, slash, the combining vowel, and 99% of the time the combining vowel is an O. So if you look at all the combining forms here, so if I ask for what is the combining form of the word dentist, and you will reply dento. What's the combining form of orthodontist? You will reply odonto. Okay, but we look at the orthodontist. The prefix orth or ortho means to straighten. So the difference between the orthodontist and the dentist deals with diseases and disorders of the oral cavity, specifically the teeth and gums. But the orthodontist, their specialty is to straighten misaligned or misaligned teeth. Okay, so know that distinction. Gingivitis, inflammation or infection of the gums. So it is the dentist that deals with that, not the orthodontist. Hypoglossal, we have a nerve underneath our tongue, al pertaining to hypo, underneath. So in this hypoglossal, hypo is the prefix, gloss is the root, al means pertaining to, and that's the suffix. Now, if I ask, what is the combining form of the medical term hypoglossal, you will answer gloss slash O, because the combining form is a root with its combining vowel. Okay, so please, that's like the number one thing that everyone gets wrong on the midterm, and I'd like to change that for this midterm. Sublingual, sub, again, another prefix meaning underneath. So if I order sublingual medication, it doesn't go in the side of the cheek. My patient doesn't swallow it, right? The patient puts it underneath their tongue. Okay. Sublingual medication, we put, and a classic example is this little white pill, nitroglycerin. It helps with angina or heart pathology induced chest pain, and it opens up all the blood, not all the blood vessels, but your arteries, so that you get more oxygen into the heart and it won't hurt as much. And the neat thing about sublingual medication is that it goes right, if you look in the mirror and look at underneath your tongue or your sublingual area, you'll see there's a whole bunch of arteries and veins in there. So that medication goes right into your circulatory system, and it bypasses the liver, which is a really neat thing. And that is called first pass effect. You will learn that in your anatomy and physiology class. Oral, al, pertaining to mouth, right? If you have P, abbreviation P.O. P.O. per orum, or oral medication, that means my patient has to take it, they swallow it, and and then the liver and the stomach then takes care of it. But the sublingual meds goes right into your circulation. Tylo is saliva. Tylism is excessive salivation. You could also have excessive salivation in sialorrhea. Excessive salivation could be also called hypersalivation. Doesn't this set right here look like a beautiful all of the above question? Which of the following medical terms means that my patient has excessive saliva? Is it tylism, sialorrhea, or hypersalivation? And your answer would be all of the above. So when you're looking at your notes and reading, put things together, things like this together. I missed that stomatopathy. Pathy, you think process of disease. Stomat, we already learned from the last lecture, is to create a mouth or an opening. So stomatopathy is mouth disease. Stomatopathy, very, very common in cigarette and cigar smokers. Usually leads to infection to cancer. Your esophagus, us means structure of, and your esophagus is your structure of your food tube. And we could scope and do an upper GI scope called using the instrument esophagoscope, and esophagoscopy is the procedure. So remember, scopy, think the procedure, that's the thing that you're scheduling. The esophagoscope is the actual thing that I'm using, the actual instrument. Okay, so know the difference between scope and scopy. That's also another tricky one that a lot of students get mixed up. Pharyngotonsillitis. My patient not only has inflammation or infection of their throat, they also have inflammation and infection of their tonsils. So that's pharyngotonsillitis. Gastroscopy, kind of talked about, it's related to this. So you could take any part and then just put it right on the scopy or scope, and I could ask you about it. Now your pylorus. Your pylorus is the first part. See, you got to use your imagination. Imagine if the liver wasn't here. Well, why am I doing it that way? Let's look at the stomach. If you look at the stomach, it's in parts. And this part right here, your heart's like over here somewhere. And this part right here is your, if you see, it's like a ringed muscle. And here you could even see it, kind of like a purse string where, you pull the string and then it should close all this up. And that's all that a sphincter is. It's a doorway that can close up. So you have one doorway here in the top of your stomach and another doorway on the bottom of your stomach. The one on the top is called your esophageal sphincter, also known as your cardiac sphincter. Now, that's a misnomer, cardiac, because that's what, when we say things like heartburn. When you have heartburn, your heart isn't on fire. It's the gastric acids that are here that are leaking from your esophageal sphincter into your esophagus, and that's where it causes the pain. Now, on the other end, going into the duodenum, which is the first part of your intestine, you have another sphincter or another circular muscle or door that can be closed, and that's your pyloric sphincter. So going back to this word here, pylorus. This is your pylorus or your pyloric sphincter. This is your esophageal sphincter, right? Also known as your cardiac sphincter. So pylorus, if I'm performing pylorotomy, I'm making an incision in this pylorus in the lower portion of the stomach. So it's this part, pyloric canal, pyloric sphincter, and goes into the first part of your intestine, which is your duodenum. So let's look at some suffixes, things on word parts that are on the end. Anything pain is algia and dynia. Do you see how your textbook put it in the same place? Doesn't this look like a beautiful both A and B question? Which of the following means stomach pain? Gastralgia, A. Gastrodynia, B. C, both. D, neither. So in this case, it would be what? The answer would be C. Gaster means stomach. Algia means pain. Gaster means stomach. Dynia also means pain. So gastrodynia, gastralgia means the same thing. And they're both suffixes that mean the same thing. Emesis or emesis, potato. That's vomiting. So you have that little kidney bowl they have? Ever see it? Emesis bowl or emesis basin. You see here? And especially the plastic ones, They have little gradations here on the side so they know how much you vomited, because that's really important. Not only the contents of what you vomited, but the volume, especially if I'm trying to watch out my patient's hydration status or how much fluid do they have in their system. So if my patient has hyperemesis, hyper, too much. My patient could have hyperemesis gravidarum, which is also known as morning sickness. But you ladies who have experienced morning sickness or hyperemesis know that it's a misnomer. It should actually be called morning, noon, and night sickness, because my patient's vomiting all the time, and that's hyperemesis. We either give you a Dancitron or make you suck on the ice chips. That sometimes helps. Anorexia. Orex means appetite. Ia is state or condition. So the suffix ia, state or condition, and no or not or without, orex, meaning appetite. So anorexia in its general term means that you just don't feel like eating. So if you're sick, of course you're going to have anorexia. You don't feel well. When all of us are sick, you don't want to eat. You don't feel like eating right now. But what is this term? Let me see. Where's my Microsoft Word? If you have something like this, OSA is like osis, abnormal condition of your nerves. So someone who has anorexia nervosa, that's a person who has a psychiatric condition that of extreme nervousness about eating, nervousness about looking funny. Most people who have anorexia nervosa have body dysmorphism syndrome. What does that mean? Let's look at the word dysmorphism. Dysmorphism. Ism's process of. Dys is a prefix, means abnormal. Morph means shape. So, process of abnormal shape. Patients with body dysmorphism syndrome, they always look at themselves like they're monsters, like there's something wrong with them. Like if you are mentally stable, no matter how bad you look in the morning, you always look in the mirror and go, yeah, I look okay, or I look good for me. But people with body dysmorphism, they feel that they're in the wrong shape, and they look at the mirror and all they see is a monster, and they think there's something wrong. And anorexia nervosa could be part of that, because they look at their body and like, oh, I can't eat, I'm way too fat. And these people who are very nervous about that, they're not obese, they're nowhere near obese, and that's why they get into this trouble. And it's not the stereotypical, teenage girl. It could be an adult, both male and female. There was a lovely study that was done about the self-esteem of young teenage boys, especially in the gym. They look at their muscle-bound heroes, and their heroes are all steroided up, and they're wondering why they don't get any gains, because I'm not on steroids. And just know that, gang, especially for those of you who have children, tell them not to look at the TV. A lot of people on TV have like 4 and 3% body fat. That is totally not normal. A normal body fat for a woman is 18 to 20. We should be promoting not how you look, but more how is your health, how do you feel, and also the metrics on, are you actually healthy? Megaly, too much, too big. So gastromegaly, I have an abnormal enlargement of my stomach. If I had cardiomegaly, I have abnormal enlargement of my heart. If I had splenomegaly, I have abnormal enlargement of my spleen. So again, the suffix megaly means enlargement, and specifically, it's an abnormal enlargement. Pepsia means digestion. So if you have dyspepsia, this is the prefix meaning abnormal. Ia, state or condition. Peps means your digestion. So it means like epigastric comfort after you eat. And not only epigastric comfort, discomfort. But discomfort, we not only mean pain, there's also bloating, cramping, also a lot of gas. And the term for gas, or, I don't know if it's a vulgar term, but for farts, the term is flatus. So if my patient is, the adjective is flatulent, that means they got a lot of gas. Okay? And it's flatus. That's when if your patient's flatulent, that means they're farting a lot. And that means there's the GI problem somewhere. Or they could have dyspepsia, especially if all this stuff happens after they eat. Dysphagia, abnormal swallowing or eating. I could also have polyphagia. I could be eating too much. In the case of diabetics, polyphagia. Diabetics, their system is telling them that, oh, your gas tank is empty, when in reality, your gas tank is full, right? It's just that the fuel is not getting into the inside of the cell like it's supposed to. Diarrhea. Rhea is excessive flow or discharge. Dia means complete or thorough. I like the older version of the definition of dia is complete or thorough. So because across means trans and through means trans, but dia is complete or thorough. So what's scary about diarrhea? Your small intestines are supposed to take in nutrients. Your large intestines is supposed to make feces or waste products, and it's supposed to take in water. If you have diarrhea, everything that you ate, it's just going to go right through you, especially the water. So the two things that I'm concerned about is dehydration, because all the water now is in the toilet, and also malnutrition, because anything that I ate is also now in the toilet. That's why diarrhea is a serious concern, especially for your very young patient and your very old patient. I had several children and infants die in my care because of the diarrhea wasn't managed in a timely manner. Same thing. I don't think I had anybody because when I was in IM, I didn't see a lot of really much older patients. But the older you get, the harder it is for you to recover from dehydration. So diarrhea, even though it's a messy, yucky thing, embarrassing thing, it is a serious thing. Okay. So let's move on. Wait, hold up. Actually, let me update the attendance. Give me a second. So I have 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Good. We're good. All right. Next, let's look further down. All these, these are nice to do in your textbook if you have time. But again, you have medical language lab. It does the same thing. Esophagus, GI, we already talked to that. PUD is peptic ulcer disease. Now, what's an ulcer? An ulcer is a hole in your stomach. Now, your stomach is lined with acid, but there's a decent amount of mucus and these two lovely sphincters, your pyloric sphincter down here and your esophageal sphincter up here, to keep all that acid in check. But what happens when you're stressed out, eat way too many salty foods, eat way too many spicy foods, you could get a hole in your stomach. Okay. And the hole in your stomach is called an ulcer. Okay. And then you'll have what they call peptic ulcer disease. And you'll have dyspepsia, flatulence, cramping, all of the above. Let's see. We already talked about upper versus lower GI. Oh, let's look at this 25-cent word. Esophagogastroduodenoscopy, also known as an upper GI series, right? EGD for short, but I just call it a upper GI scope or upper GI endoscopy. So you look at that, it's the esophagus, which is your food tube, your stomach, and your duodenum, which is the first part of your small intestine. Okay, so that looks like, I could ask, what are we scoping? What are we looking at? A, esophagus, B, stomach, 3, small intestines, D, all of the above. Answer for an upper GI is, for this particular word, is all of the above. Let's see, what other thing here looks good? Oh, let's go back and just review real quick regarding lump or bump. And how do we know that a lump or bump is cancer? So oma, the suffix oma, it just means it's a lump or bump. Sometimes we even use the word mass, but you use the word mass, it kind of triggers patients. They think it's cancer. Now, if I find a lump or a bump, I'm going to have to do something called a biopsy. And the biopsy is, opsy is process of viewing. And what's bi? Life. Bio means life. So what are we doing in a biopsy? I'm taking that lump or bump, which I don't know anything about, and I'm going to process of viewing it live, for real, in real life. And the person who's going to do that is the pathologist. They're experts at microbiology and histology with respect to disease. That's what patho is. So we send it to the path lab or patho, and they look at it. And if they look at it and they find it's cancer, then they will label it as a carcinoma. Oma means lump or bump that is cancerous. Now, what is cancer? Cancer are cells that keep on repeating, and they just keep on growing. So you could see how much damage they do. So they not only do a lot of damage by just growing out of hand and ruining all body structures or obstructing body structures. Another thing that growing cells do is eat up nutrients. And that's why the patient then has cachexia. ES state or condition of wasting or wasting away. Sometimes cachexia is called wasting syndrome because a very common chief complaint of a cancer patient is, hey, I'm really tired and I lost like 20 pounds in the last couple of weeks. You shouldn't be losing more than like 1.5 to 2 pounds per week per 7 days. Anything greater than that, it's non-physiologic. Even if you're working out, 6 hours a day and eating like 900 calories, you shouldn't be starving yourself and you shouldn't be losing that much weight too fast. And that's called cachexia, which is a classic sign in our cancer patients. And carcinoma is abbreviated capital C, capital A. Okay. And biopsy is abbreviated capital B with a little X. All right. Let's take a good look at that for a minute. Okay. Epigastric is a nice word. Ik pertaining to, that's suffix. Epi is the prefix, and epi means right on top of. And I'll be, instead of waiting, let's just show you the abdominal quadrant. And I could show you how you could use the abdominal quadrants, use your medical terminology powers to figure out the abdominal quadrants. Now, we start with the belly button, which is in the middle. So you could cut up the quadrants into 4, but the more specific is the more clinical answer in the emergency room. So if my patient's having pain here in their belly button, that's the umbilical region. If it's above their stomach, so your stomach lies around here somewhere, right? But above the umbilical is your epigastric. So epi means right on top, and hypo means underneath or lower. So you have your epigastric up here, umbilical in the middle, hypogastric down here. Now, you have 2 sets, right and left. If you look at the word hypochondriac, ac pertaining to, hypo underneath, chondr means ribs. So here's the bottom part of your ribs. So this is the area just right on the bottom part of your ribs. Lumbar, AR means pertaining to, lumb is your loin. So where do you hang a loincloth? You hang it where? Here, around the middle of your waist. And that's your lumbar region. And your bikini line, which is here, which is your iliac region. Now, remember, when you're looking at your patient, where's the right side? It's here. Left is here, right? It's not your right. It's always at the perspective of the patient. Now, knowing this and knowing your medical terminology powers, do you think I could do this to you on your exam? Boop. And label it A, B, C, D, E, F, G. Now, this is easy. This is the 4 quadrants. So remember, but always remember that this part here is the right side of your patient. This part here is the left side of your patient. So let's actually do this. I can copy this image. Put it here. Okay. So if I look at this, this is what I do in my head. I always label one side. This is the right, and this is the left. This is the right, and this is the left. So, and let me draw a line here so we're not confusing these 2 patients. I could ask you, okay, this region here, A, B, C, D, this has to be the right upper quadrant. Now, if this is the right upper quadrant, this has to be the left upper quadrant. And if that's the left upper quadrant, this has to be the left lower quadrant. If that's the left lower quadrant on the left side, this has to be the right lower quadrant. It's a little bit extended Q there. Let me erase this. I'm being a little bit of a neurotic. And if we look at that word, neuroses, osis, abnormal condition, neur is nerves. So I'm being a little bit nervous, being a perfectionist here, which is okay. It's okay to be a little bit on the nervous side. That's medical. But if you're overboard, that's neurotic. That's never good. Now with this one, we can always start in the middle, and that's your belly button. So this has to be the umbilical region. And remember, with whatever's on top, it's got to be the what? Epi, right? And whatever's on the bottom has to be hypo. So this has to be the umbilical, this has to be the epigastric, and this has to be the hypogastric. And do you remember the three here? The one right underneath my ribs, hypochondriac. So I got a right area. And then I have the lumbar or loin. I always remember Tarzan and his loincloth. So this is your lumbar region. So that's your right lumbar. And bikini line, it's your inguinal, right? You have a muscle here called your inguinalis as well. So that's got to be the right inguinal area. So you could see how you clump things together. First learn the middle, then right, and then you just repeat it for the left. So this is, if this is the right hypochondriac area, this has to be the left hypochondriac area. If this is the right lumbar area, this has to be the left lumbar area. If this is the right iliac area, this has to be the left iliac area. All right. Okay. So that's the quadrants, and you'll be good. This little lesson part here, that's good even for anatomy and physiology, because you'll have also that in anatomy and physiology too. And I think I kind of, I think I went over that in the video for chapter 2 at the end. So that's a nice little neat review. Dyspepsia, dysphagia, we already went over that. Aerophagia, which is swallowing air right here. Aero means air, and that's not good. That'll lead to excessive flatus, bloating, and epigastric pain. Infants are really good at that, and that's why now we have bottles. I don't know, they kind of work. You know, those of you who have babies or remember having babies in the house, you know, those those bottles with the special nipples that you know, that didn't take in air. I don't know, it's semi-work. It depends on the child. Okay, now all of those previous words that we went over, those are upper GI terms. Now here are the lower GI, and remember, it's everything from the stomach on down. So let's look at your small intestine. There's 3 parts to it. You have your duodenum, your jejunum, and your ileum. Remember, means structure of. So this is the first part, duodenum, second part, jejunum, third part, ileum. So if I want to scope the first part, which is kind of on the borderline of an upper GI series, that's your duodenoscopy, right? Entero is a generalized term for intestines. So enteropathy means simply just means, oh, my patient has an intestinal problem. And yeah, we use it interchangeably, but when we usually say entero, like enteropathy, typically GI med means that it's a small intestine. If they use the word colon, it like colonopathy, that means it's a large intestine problem. So colon is typically large intestine, entero is typically small intestine. Just for your edification, I won't go into that level of detail for midterm, but if I say enteropathy, intestines is good enough. Pathy, disease process of intestines, and you should be good enough. Jejunum, that is the second part of your small intestine. We could also suture any of these parts up. So you can have a duodenopathy, duodenopathy. I'm tongue-tied when it comes to these. Jejunopathy, potato. But just know that raphy is the suffix process of suturing. And I don't know why I always remember my classmate Raphael. He was a good guy. looked like a bouncer, if I recall. Great surgeon, and that's why I always remember Raffi surgery suture. Ileostomy. I could put a stoma, a connection between the third part of the small intestine and the outside world. Because if I do anything to the large intestine, I don't want any of the products that are going through here to go into the large intestine. And remember, the function of the small intestine is for nutrient absorption. The function of the large intestine is feces production and also water conservation or water intake. So we can I can put in an ileostomy bag, and it's usually done if I did a total colectomy, meaning all of this stuff, the large intestine, I removed everything, and that's called an ileostomy. Now, what are large intestine? Now, your large intestine has this vestigial organ. Vestigial means that it's just there. It's kind of like your earlobes. It serves no real purpose. Your ears have nothing to do with your hearing. I mean, your earlobes have nothing to do with your hearing, but it's just there, right? It's a nice place to hang jewelry. Also, the top part of your ear is a nice place to, hold up your pencils or your glasses. But a vestigial organ like your appendix, it serves no real purpose. And where's our appendix? Let's look back in this picture here. There's a picture of large intestine. Here you go. This is your large intestine. How do I know it's my large intestine? Because the diameter is much, much larger than your small intestine. And you can see here, you got this little outpocketing, and that's called your appendix. Now, your appendix is it's not a really big deal until it gets all inflamed and gets all messed up. Now, remember, what's in this large intestine? Feces, right? E. coli, bad things. But as long as it's in there, it's okay. But what happens if this gets inflamed and this bursts? That's bad news. The covering, also known as your peritoneum, right? Peri means surrounding, will get infected and you'll have peritonitis. And then that infection will go inside the peritoneum. It'll go inside the peritoneum. It'll go inside the arteries and veins. And then you'll have something called sepsis. And that you can die of. So I'm not worried about the appendicitis. I'm worried about if it bursts and the sequelae. What horrible thing will happen next if I don't deal with it? Gastrodynia, we already talked about. Emesis, we already talked about. Oh, why am I going through that? Wrong list. So that's your appendix. So I have appendicitis, right? And what do I have to do? I have to perform an appendectomy. Ectomy means to excise or to cut out, and I will cut out my appendix. And what usually gets stuck in there? Most common is impacted feces, or what they call a fecal lith. Lith means stone. So if my patient has like a dehydration problem, the feces, right? Feces, which is the waste product, will harden up, and it'll harden up. And those of you who work as a CNA, you guys know digital removal of impacted feces is the worst job ever. I got to stick my finger down in there, and I have to pull out these rocks. And it causes damage to the lower GI, also known as your colon. Now, I could put a colostomy bag. Let's say, for example, I did some surgery in the tail end of your large intestine, near your anus and near your rectum. Well, I don't want feces to pass through here for a couple of weeks. So I make a stoma, also known as a colostomy, and then I could grab the waste in the colostomy bag other than it going through here. Lower GI series is also called a colonoscopy, because remember, the generalized term for large intestine is colon. And we have to put a fiber optic tube through your anus, and the anus is essentially just a sphincter. It's just a the opening, but the tube that leads to the anus is called your rectum. Okay, and that could prolapse or herniate, right, or stick out. Because remember, herniation, something that sticks out that shouldn't stick out. So that tube, known as your rectum, especially with mommies who have a lot of babies, like 8, 9, 10 babies, sometimes you'll have rectal prolapse, also known as a rectocele. I could also do a small part of a lower GI series called your sigmoidoscopy. And if I see something there I don't like, I can cut things like a polyp or tumors. Sigmoidotomy. So I can cut into it. Okay. I'm not removing any part of the sigmoid, but I'm cutting into it. Okay. Tomy is different than ectomy. Lovely picture of the GI system. We haven't talked about this lovely thing yet, and we will. It's your gallbladder and your liver. Here's a colostomy, right? Let's say I did some surgery down here. I don't want feces touching this for at least 4 to 6 weeks. So what do? I make a hole here, attach it to a bag so that all the feces will go where? Into this bag and not down into my sphincter here. And then the last part here is your rectum, this tube here. And then this curved tube here is called your sigmoid colon. So it looked like we did a sigmoidectomy here and then did a colostomy here. Let's see. What's next? Pyloric stenosis, really common when babies who pyloric and esophageal stenosis are really common in premature infants, and that's why they can't keep down their milk. Well, not the only reason, but this is a significant one. Sigmoidoscopy, colonoscopy. So your anus is the sphincter, circular muscle down here. Your rectum is this part. Sigmoid is what? This last part. Then you have your ascending, transverse, and descending colon. Okay, and if I stick a tube all the way down there, and it has a fiber optic tube, and things can come out of the tube, and we could take biopsies. We could do little mini surgeries in there if we like. Okay. Again, ascending colon, transverse colon, descending colon, sigmoid, rectum, and then the anus. Oh, here's lovely. This is another one I want to focus on. Right here. This is probably one of the most confusing medical terms right here. And I hate doing an anatomy class, but I need to do an anatomy class so you know what these things are. What's bile, gallbladder, bile duct, and bile vessel. So and also the tricky thing about that whole entire thing is that all of these words, they look alike. So what is your gallbladder? Your gallbladder is this thing, and it's not green. We just color it green for the textbook. It's underneath on the inferior surface of your liver. And your liver makes this stuff called bile. Bile is what they call an emulsifier. And what do emulsifiers do? They break down big fat globules into little tiny globules called micelles, because it's easier to deal with a micelle or tiny little fat globules versus dealing with big fat chunks of fat globules in your intestines. The smaller the something is, the easier it is to be absorbed. So that's why you need your gallbladder. Now, The bile gets made in the liver, but then gets stored in the gallbladder. And then you have these ducts, right? So you have the cystic duct, right and left hepatic duct, common duct, bile duct, and a duct is just simply what? Like, in your heating and ventilation system in your home, okay? They're just pathways, they're just like vents. And they connect into your duodenum, which is the first part of your small intestine. So that's what all of that is. So when we look at the medical terms, a bile vessel is any one of those tubes. So goes, and the smaller tubes are called cholangioles. So a cholangiole is a very small bile vessel. Now you could have stones in there, in anywhere in those green parts, and that's called a cololith. We already looked at the suffix lith. Lith means stone. Another word for stone is calculus. The way I remember it was calculus was really hard. So that's what this stone is. It's really hard. So a gallstone, also known, or a bile stone, is also known as a cololith. And you could have something, a normal condition of gallstones, known as cholelithiasis. Now, your gallbladder itself is cholecyst. Now, if it gets really damaged in really bad cholelithiasis, or I had cholelitis, that's never good. I might have to remove the gallbladder, and that is called a cholecystectomy. Now, the bile ducts, remember you had a right, left, main, common, right? I sometimes have to cut into those things to get at these cololiths or to release pressure. And that's called a choledochotomy. Your liver's right above it. All of these things could be caused by liver infection, and that's hepatitis. And the pancreas is in that area as well. That's a major gland that deals with insulin and glucagon. You learn more about that. What do you call that in your anatomy and physiology? Oh, my boss is calling me, but I'm in the middle of a lecture. So it's a major gland, especially dealing with your GI. Okay, so you could see how they kind of all look like each other. Cole, right? So be careful of these. So since they all look and act like each other, what are the odds this is going to come out on the exam? Pretty darn good, I think. Hint, hint. Cholelithiasis. Chole means gallbladder, right? Lith, stone. Man, it must be something bad. Well, we're at the tail end of the lecture. I'm going to call her in a minute. Cholelithiasis, abnormal condition of gallstones, bile stones, right? I either have to take out the entire gallbladder or I can cut into it, choledochotomy, and, take out whatever stones. Hepatomegaly, we already went over. Now, post and preprandial. Post is the prefix that means after, and pre means before. Be careful of these words, preprandial and postprandial. They look really alike, and you could totally ruin your patient's day if you gave the meds at the wrong time. Okay? How many times have I messed this up in my career? More times than I care to admit. There's a lovely, lovely picture of your gallbladder, your common bile ducts, right? And you also have these smaller cholangioles here. This is, of course, your liver, okay? The largest metabolic organ. So you don't want that to have itis. Hepatitis is bad news. As a medical care professional, you should be worried just as much as HIV as hepatitis regarding blood-borne pathogens. That's why we have training in the hospital regarding blood-borne pathogens, like what, every 6 months? Here's your stomach, of course, and behind it, here's your pancreas. You can see it has a head and then it has a tail, okay? Here is your pyloric sphincter. Here's the duodenum, which is the first part of your small intestine. Oh, hepatitis, and it could be anything, bacterial, viral, but no matter what, it's bad news because remember I said it is the largest metabolic organ. That means it does a lot of metabolism, and that's why drinkers, alcoholics, not just drinkers, but alcoholics, they have a lot of GI problems, and they also have a lot of nutrition problems because of hepatitis or cirrhosis, which is hardening of the liver. And let's see what else. Oh, look, here's some stones. I mean, this is exaggerated. That's freaking a lot. Okay, but it is what it is. Never know. You could have a whole ton of stones. Here's some practice. Okay, let's look at some, and we're not going to go into the pathologies. That's for your pathology class, but definitely regarding communication, you need to know the abbreviations. Because eventually, if we look down all the way here, we got cases. And that's for next week. We're going to start reviewing all the cases. We're going to start with the cardiovascular, then the respiratory, and then the GI, and then catch up to whatever we're doing. So, abbreviations. The Joint Commission, or JCO, Joint Commission on the Accreditation of Hospital Organizations, also known as JCO, JCAHO, or people in the business, we just call it the commission, right? They are the people who check all of our processes in the hospital. Make sure we're doing the same thing, the right way, the same way every time. Because if you do something different for each and every patient, then there's going to be a quality control problem. So let's look at some, and they don't like abbreviations, but we need to know abbreviations because it's in the electronic medical record, you know, in the drop-down screen, and it's also many old school physicians and nurses still use a lot of abbreviations in their notes. BE, barium enema. Barium is a contrast material, and what do we mean by that? It when I shoot it, let's look at barium enema. This is what I do. Here you go. Right? We give you an enema. An enema means that we shoot water or barium, water with barium, and the barium is a contrast material. And why do we like it? Because then it can do this for us. Oopsies. When we take a abdominal plate or abdominal x-ray, we could see the structures a lot clearer. Now you could easily see here, right? We put the enema, we shot up the water, and it made everything like light up. And you could easily now see here, there's stenosis starting from this splenic flexure on down, and this is your descending colon. Here's your sigmoid, and here's your rectum here. Here's your appendix, ascending transverse colon. So when you look at it, everything looks cool until you get to here. Something's up, right? There's some inflammation process here. That means my patient has colonitis, right? And that might be a problem. And that's what we do barium enema. Okay. BM, bowel movement, BMI, body mass index. Now we use body mass index. It's not as popular anymore, but we still use it as a way to, it compares your height versus your weight. And we use it to see what kind of progress you're working on in your weight loss. CA, carcinoma, we already went over. CT, computerized tomography, we went over. Diagnosis, we should already know. Biopsy, BX, we should know. EGD, we went over. Let's go at ESWL. ESWL is extracorporeal shockwave lithotripsy. Say that 8 times fast. So if you look at it, this is what it looks like. Where's the most? There you go. ESW. I don't want the video. There you go. Extracorporeal. That means extra means out. Corpo means body. So you have this transducer here, right? And there's like this water bladder that's here, and it's gonna shoot sound waves, and the sound waves will break up litho stones. So lithotripsy is the process of breaking down stones, and ESWL does it this way: extracorporeal shockwave lithotripsy, or ESWL for short. And it's because I got some kidney stones, and I don't want to do surgery just yet. I want to break them all up and hoping that my patient will pass it. That's ESWL. FBS is fasting blood sugar, also known as FBG, which is fasting blood glucose, right? That's the one where you take the little pinprick on your, on your finger. GERD is gastroesophageal reflux disease. Now, gastro means stomach. Esophagus is your food tube. Reflux, means to go back. So typically, food and whatnot flow down. But if it too much acid due to too much salt, too much fat, or you're a smoker or you're a drinker, it kicks back up and you can have GERD. GI is easy, IBD, inflammatory bowel disease. That means there's some sort of itis going on in, I have colonitis or enteritis. IBS, irritable bowel syndrome. It's related to this. It is a confluence of a whole bunch of signs and symptoms that are from IBD. IV, intravenous, of course, we put the medication into your vein. Lower esophageal sphincter, also known as your pyloric sphincter. Yes, they use this, LES. And then UES is your upper esophageal sphincter, which is your cardiac sphincter. MRI, magnetic resonance imaging. That's that big machine. And because essentially human beings are pluses and minuses. And just know that because the alignment of pluses and minuses in your body, the MRI can pick up things. NGT is nasogastric tube. It's a tube that I'm going to put that's going to lead down to your stomach, and I start at the nose. And that's what an NGT is. OR, operating room, PUD, peptic ulcer disease. We already know what an ulcer is. RGB, yeah, they kind of use it. Roux-en-Y gastric bypass. Now, what is that? It's French, right? It's part of bariatric surgery. Okay, and bariatrics is, if maybe you saw my 600-pound life, that kind of thing. So just know it's a gastric bypass. I cut off here and then go straight from the esophagus, and I bypass everything, so that and that's called a Roux-en-Y. Just know, you're bypassing your stomach. I am not a fan of Roux-en-Y bypass because remember, if you don't use it, you lose it. It causes a whole bunch of problems in your GI. But again, bariatric surgery, there's pros and cons to it, just like any other medicine or any other thing in the medical world. RUQ, LUQ, RLQ, and all that, we showed that previously. Remember when we showed this picture? So if my patient has RLQ pain, that means right lower quadrant pain. US is ultrasound. Ultra means above, sound. That's why you don't really hear it when you're you're scanning somebody. And this is a good first diagnostic. It's not a definitive diagnostic. In GI Med, we like X-rays, CT, and MRI. Ooh, why am I yawning? I slept a million hours. All right. So it is at this point of the show. I count 1, 2, 3, 4. Well, 4 people now, but I written down there was 5 people earlier. Maybe somebody had to log off because of work. It is at this time where I'm going to stop the recording.